Good afternoon, this is Brett Hayworth for Siouxland Public Media News. Governor Kim Reynolds is not running for re-election, setting up a wide-open race in Iowa in 2026. Reynolds first became governor in 2017 after Terry Branstad was appointed as ambassador to China. She was re-elected twice in 2018 and 2022. In a video statement released Friday morning, Reynolds said she is stepping aside at the end of her term to give back to her family that has supported her political career. Reynolds has led a Republican trifecta in state government since becoming governor. She has used it to enact a broad restructuring of state agencies, to expand charter schools and education savings accounts, and to establish a flat income tax. Former State Representative Brad Sherman is the only Republican who has previously announced plans to run for governor. On the Democratic side, Paul Dahl of Webster City is the only candidate who has announced plans. Northwest Iowa Congressman Randy Feenstra in a release said Reynolds has performed well as a governor. According to Morning Consult, Reynolds is the nation's most unpopular governor. She has a -5 net approval rating and the only governor nationwide with a majority of disapprovals over approvals. Additionally, a special project is underway to boost home ownership by lower-income people in Sioux City. There will be an open house at noon Sunday, April 13th on West 5th Street between Isabella and Myrtle Streets. There will be 11 homes of roughly 1,400 square feet in that area that are designed to be affordable for families of varying sizes making under $85,000 annually. The city's Neighborhood Services Division is working with a developer using Home Investment Partnership Program funds from the U.S. Department of Housing and Urban Development.
Good afternoon, I'm Alejandra Perez for Siouxland Public Media News. The state's Maternal Mortality Review Committee report looked at 20 pregnancy-related deaths that occurred between 2019 and 2021 and determined 19 were preventable. It found that deaths disproportionately affected people who are Hispanic and Black and on Medicaid. Stephanie Radke is an OBGYN at the University of Iowa Healthcare and the chair of the committee. She says the committee reviewed extensive records to determine how preventable each death could have been. That includes such things as their interactions with the healthcare system and their social situation around the time they became pregnant. The report makes numerous recommendations for healthcare providers, facilities, systems, and communities, including better screening and care coordination efforts. And now more news from Brett Hayworth.